Good afternoon, sir.
Good afternoon, sir.
Good afternoon, Praveen. How is that one Guwahati girl has joined here? Huh? Bhaskar, you gave this
Sir,
Guwahati girl. Huh?
I don't know, sir.
How she got your ID? How? Bhaskar, you are doing something. Huh?
No, sir. I don't know.
Okay, no problem. Anyone who wants to join can. I put in an HPD group, so anybody wants to join can join. It's all learning. Doctor, how was the situation?
Good afternoon, sir.
Afternoon. How are things there?
All good, sir.
Now, as on today, how many cases we have?
It's just I would just say it's more than 20, but it's all they're all stable. That's the positive, so it's okay.
Okay. So women hockey, how many cases are women hockey?
There are a few, sir.
I was told 7 or something.
Yeah.
Praveen, we'll wait for 5 minutes more, or should we start? Because only we have now 14 people there.
Sir.
Our center itself find lots of absentees. Hey, Ranganathan, what has happened to our people?
I think they all forgot about it. I'll just Darshan couldn't attend because of his mobile broke down. I'm going to room now, so Darshan will attend with me now.
Okay.
I'll just pass a message, sir. I'll just remind them.
Okay. I find no coaches join. I don't know why they're not interested in NCA coaches. Oscar just put that in the group once again. Yeah, ask them to join.
Yes, sir.
You think we'll start?
Yes.
Yeah, okay.
Shall I start, sir?
Yeah.
The screen visible?
Yeah.
Uh, yes, sir. First of all, I welcome you all for this presentation. In today's presentation, I will be discussing the mechanical loading of bone, the basics of mechanical loading of bone, and I will be discussing one specific example, several examples pertaining to that. So, as we know, bone is a very dynamic tissue. It's composed of matrix of inorganic salts and collagen, which basically gives its tensile strength, flexibility, and as well as the compressive strength also, with the help of other bone minerals. So, as we know, bone is a part of our skeletal system, which protects our internal organs. It also acts as a storage site for fat, especially in the form of yellow bone marrow, as well as production of red blood cells, as well as white blood cells via red bone marrow. It also stores and releases minerals, and it facilitates movements, and it supports our body. It provides support and form to the body. And as I said, it protects our internal organs from injury also. So if you look at our skeletal system, it can be divided into axial as well as appendicular skeleton. In axial, we have our rib cage, the vertebral column, and the skull. Apart from that, the rest of the bones which are involved are part of appendicular skeleton. Now, this is a brief anatomy of, I won't go much into the depth. So here you can see the outer covering of bone, which is known as compact bone or cortical bone also. It is a hard outer shell, and the inside part, which is known as a cancellous bone, or which is also known as spongy. So here in bone, we have different cells, types of cells also, osteoclasts, osteoblasts, and there is always a balance between, especially if I'm talking about bone modeling, there's always balance between bone formation and bone resorption. Bone resorption is taken care by osteoclasts, and osteoblasts basically take care of bone formation. So, bones can be classified according to their shapes. Here we have the long bone which have great length as compared to the width. Examples are femur, tibia, humerus. Short bones, they are cubical in shape. For example, carpals and tarsals. Flat bones, they have broad surface, especially for attachment of muscles. For example, scapula, ilium, sternum, ribs. Then we have irregular bones. They are complex and mixed shape, especially for bearing compressive loads. Vertebra, here we have vertebra, sacrum, facial bones. Then sesamoid bone. They basically develop within the tendon. For example, patella. Now, as the topic is mechanical loading, just discuss certain basic concepts regarding stress and strain. Yeah. Now, this is a typical graph of stress versus strain. Now we'll define what is stress and what is strain. Stress is force per unit area, and the unit of stress is Newton per meter square. And strain is change in length divided by original length. So here we get the strain. That means you are basically looking at the length. So and stress, if you look at stress, it can be of many types: compressive stress, tensile stress, which we'll discuss further. So normally, if I generalize, there is a normal stress and there is a shear stress. If force is applied, suppose this is a cross-sectional area of a bone, and if a force is applied perpendicular to the plane of the cross-section, that becomes the normal stress. And if force is applied parallel to the plane of the cross-section, that becomes the shear stress. So if we look at this relationship, and if you look at this graph, you will see an elastic region, the plastic region. So as stress increases, as the amount of stress increases, the amount of strain also increases. So there is a particular point at which the material has a tendency to come back to its original position. And that basically is known as the yield point. And that base point, below that point, basically defines the elastic region. If you further increase the stress, the length increases or decreases, the strain, there is strain. But here we have a zone from which, if you suddenly release that stress or force, the object or material tends to return, but it does not return to its original position. So in that situation, we have a residual strain, because there is a rearrangement at the molecular level. If you further increase the stress up to a certain point, suppose I'm talking about point E. So at this particular point, the object or the material practically breaks. That is known as the fracture point. So, and if we talk about bone, if you talk about bone behaves differently in different directions. So basically it is anisotropic. That means if you apply compressive force in one direction, it will bear it very well. But if you change the direction of the force, especially if I talk about the shear force, then limits would be tested. To understand anisotropy, now this is the figure, typical figure to understand this. So if I take a sheet of paper and roll it, and take multiple bundles of these kind of paper, so and arrange it in a cylindrical way and put a book on it, so there's a possibility, every possibility, that it may bear the weight in that direction, cylindrical direction. But if I lay it down in this particular manner, it will collapse under the weight of the book. So this is what I'm talking about. And when we talk about cancellous bone, and when we talk about cortical or the compact bone, as I said previously, also compact bone is more suitable for resisting the compressive strength. Cancellous bone is capable of tensile and bending strength. Basically, it is a mixture, which we'll see in further slides. So what are the types of loads on the bone? So this figure depicts the various types of loads. The first one is compression. Now, in a compressive load or compressive forces, try to decrease the length of the object. It basically tries to squash an object. That is compressive. Now, these type of forces normally occur in during the weight-bearing activities, during impact activities. The second type of force which is encountered by the bone is tensile force, in which it is pulled apart from one end. Now, our muscles basically apply this tensile force on the bone. So there, from there itself, we get that tensile force. In fact, muscle also apply the tensile as well as contribute to the compressive force. In fact, if you look at the normal muscle attachment in our body, if you suppose this is a bone, pardon my diagram, this is a joint. So the muscle attachment is always near to the axis of rotation or the joint axis, and it is at certain angle, which is less than 90 if you look from the joint axis. Okay, so what does it mean? Now, it means that if we resolve this pulling force, if the muscle contracts, suppose this is the direction of the pull, just to understand this, if we resolve the force, this can be divided into two components, the perpendicular component as well as the parallel component, which I call the Fy and the Fx. So this Fy basically contributes to the torque, the rotation, which happens at the joint axis while the muscle is pulling up the bone at certain insertion point. And Fx basically is the compressive force, which basically provides the support as well as compression to the bone. Basically, it provides stability. So in this way, one end of the bone is trying to push on the other end of the bone. That is compression force, the Fx component. That is compression. Then we have the shear force. So as discussed earlier, also shear force, basically the type of force which is basically parallel to the plane of cross section. Then we have the torsion. Torsion is basically known as twisting force. So we'll discuss examples also in which kind of activity there is twisting force. Then we have the bending force. Now, bending force basically, if you look at bending force, you have compressive force at one end and tensile force at another end, basically promoting the bending. Basically, there are several at several points there are multiple forces acting, so that leads to bending. So bending force even occurs during our normal gait. So our body is truly capable of withstanding that. If I'm talking about femur, so it has a tendency to bend in the anterior, bend in the forward direction. There is an anterior bend, slight bend, as well as compressive force. So now we have discussed the various types of forces. We have discussed compression force, compressive stress. We have discussed the tensile force, shear force, torsional, and bending force. Bending and torsion, of course, combination. So if you look at from the cortical bone perspective, you'll see that the bone has higher tendency of withstanding the compressive stress, and secondly, it can withstand the tensile strength and the shear force. It has less capability to withstand the shear force. So depending upon what type of activity you are doing, what type of force you are generating, you're giving to the bone, depending on your particular position. That will decide whether you're having compressive, tensile, shear. There are particular position. If your technique, if from technique point of view, I'm talking from technique point of view. As I said, like your body has more capability to absorb the compressive force as compared to the tensile force. So the body tends to avoid, or from technique point of view, the body or you tend to avoid a situation in which the shear force, you are able to bear more shear as well as tensile force as compared to the compressive. But as I said, loading takes place in all the directions. So we'll see in next slides what type of injury, what type of fractures might occur due to loading. But yeah, this is an example pertaining to cortical bone. So I will start with the compressive force. So now, so this is a typical example of a rugby player trying to headbutt. Or this example may also mimic taking a head, for example, heading a football during a game. Now there are two scenarios. This is the normal scenario, and this is the scenario in which your cervical vertebra is slightly flexed up to the angle of 30 degrees. So now in this scenario, there is more compressive force as compared to this scenario. So this scenario in which you are in a particular flex position, if you headbutt in that particular position or you head a ball in that particular direction, there are chances of compressive rupture, compressive force. So that is this position is basically detrimental to a player. Then in certain situation, like in weightlifting, in which your, especially the lumbar region, basically go into hyperlordosis, that also increases the compressive force on the vertebral column. That also may lead to certain injuries. And if I talk about knee joint, so whenever deflection is taking place, so there is a compressive force because of the certain knee joint angle, because of the because why compression happens, because whenever you flex your knee, what will happen is the quadriceps, the muscle which is attached to the tibial tuberosity, basically your patella is also in between. So what will happen is there will be a compressive force on the patella. Patello-femoral pain might occur, and if you have misalignment of your patella due to certain Q angle misalignment, there are chances that patello-femoral injury might happen. Actually, due to this compressive force, what happens is, especially on the lateral side of the patella, there is erosion of or total breakdown of your cartilage. So this happens during deep knee flexion exercises such as squatting also. Now, this is a particular example in which basically how compressive force and in combination with tensile force actually leads to femoral neck fracture. So once again, I repeat that fracture occurs only if particular force or particular compressive force is more than what the body or what the bony material can bear because of the bone mineral density or the materials, material composition. Okay, so now what happens in this scenario is suppose you're a runner, you're playing soccer, rugby, where explosive movements are there. And by explosive movement and by explosive movement as well as impactful movements are also there, when especially when you're landing your foot. So more weight is borne by your hip joint. Now, what happens in that scenario is there is compressive force on the inferior neck, inferior portion of the femoral neck. So if I can replicate this femoral like this, so there is a compressive force in this direction, especially in this region. Okay, and what will happen? What will happen because of this compressive force on the superior aspect? Superior aspect, there will be tensile forces. So normally what happens is these tensile forces on the opposite side is balanced because as I said, like body can bear more compressive forces rather than the tensile forces. So these tensile forces are controlled, or you can say controlled by the pull of the gluteus medius muscle. So this actually controls the tensile force. Now, especially in long distance runner, whenever fatigue comes into the picture, or you can say gluteus medius fatigue is there. So what will happen? That component, that balancing point, balancing act won't be there. So there is every chance now compression from one side, tension from one side. So there is every chance that femoral neck fracture may take place. As I said, especially in long distance runners, soccer, rugby, long distance runner, whenever fatigue takes place, as I've already given you an example of gluteus medius fatigue. Then there are tensile forces. Now, tensile forces, especially in the developmental stage, are very much responsible for the formation of processes, tubercle, as well as the tuberosity. These are basically muscle attachment sites. So if you can look at this figure, okay, because of tensile force means like the pulling force, which is trying to increase the length. So the bone will modulate accordingly. And as you can see in this figure, so tuberosity or a process is formed. Now, these are, as I said, these are developmental only. Now, especially in children, not in adults, and especially in children and during their sporting activity, there is chance that the tensile force is more than what the bone can bear, especially in low league pitchers. So, and low league pitchers, whenever a thrower or pitcher is throwing the ball. So there is a chance of avulsion fracture. Avulsion fracture means because of the tensile strength, a chunk of bone basically comes out, or a portion of bone is fractured at that particular insertion site. So if I'm talking about thrower, especially especially the muscles, which are your wrist flexors, and the tendon, basically the insertion site, which is at the medial epicondyle. So especially for children, this type of avulsion fracture might occur. Then there are several other type of avulsion fractures, like hamstring avulsion, again due to explosive running, that may occur. Then oversupination also. Oversupination, in which you are basically landing on the landing on the outermost edge. Now, because of that, there might be tensile forces which are acting on the lateral aspect. So yeah, because of that also you will get avulsion fracture on the lateral aspect. Then shear forces. Now shear forces, as I said in previously also, shear stress is basically a force applied parallel to the plane of the cross section. Now this kind of force, this kind of happens when there's misalignment, especially if you're talking about the vertebral column. So if you're not properly lifting any object, if I take an example of lifting a box properly, so normally the correct technique is you're placing the box closer to the body, and you're maintaining a proper vertebral stance, vertebral position. Okay, if there is slight flexion, if you are flexing the vertebral column, now what will happen is, because of the pull of the iliopsoas, because of the direction of the flexion also, more shear forces come into the picture. Now, as again, that takes me back to the curve in which the body is more accustomed to compressive forces as compared to the shear forces. So basically what happens is, because of the shear forces, like vertebral column are arranged one upon another. Okay, so there's a tendency, because of the shear force, there may be anterior slide or a posterior slide depending upon the position. That is because of the shear forces. And because of the shear forces also, fractures in femoral condyle and tibial plateau occurs, especially during if your knee is in the hyperextended position and your fixed foot is fixed, and a valgus force is provided at that particular junction. So this kind of injury also happens to soccer players, rugby players. Then we have bending forces. Now, bending forces, as I said earlier also, it happens during our gait also. Even there's a slight bend at your femur as well as tibia also. And if forces are acting at multiple points, and those forces and those bending forces actually overcome your material strength, then there's a possibility of fracture in that scenario also. So now in this particular figure, this is a example of a skier. So you'll see that in this scenario, this portion is actually fixed, and suddenly if a skier has to land or decelerate suddenly, so what will happen is, because this portion is fixed, this is pushing this in the backward direction, and because of the momentum, because of the body position, this is coming towards the front side. So what will happen is sort of bending force will be created. It may lead to fraction if it overcomes the material stress. So the same principle is actually used by braces. You must have seen, in which braces you must have seen, which are used to correct certain postural deviation. So they provide forces. They provide forces from multiple points, so that basically it will help in your in correcting your postural deviation. Then torsional force. Now we have discussed bending, shear, compressive. We have discussed tensile force also. Torsional force means like it's a twisting force. Suppose this is your bone, and the bone is if bone is fixed on one end, and suddenly a a torque or a twisting force is applied, the bone twists around its longitudinal axis. So what will happen is, again, there's a chance of fracture, and especially in games like Taekwondo. And it also depends upon the surface, the contact surface. Suppose if you see in this scenario, the lower leg is fixed. Okay. And in Taekwondo, there are several twisting and turning is required. So if there is too much friction, the lower portion is not able to twist properly. This remains grounded, but the upper body is already in rotation. So that may actually lead to certain ligamented tears, as well as torsion force also. Even if you have a poor throwing technique also, so there will be a torsional force created at your humerus also. That also may be detriment. And we all know that we already discussed different type of loading. So in everyday activity and during certain lower extremity exercises, so loading occurs in all the directions. That means compressive, tensile, bending, slight torsional force is also there. So if you look at the arrangement of collagen fibers inside the cortical, inside the bone also, you will see that they are arranged in such a way that they can withstand the tensile as well as torsional force. So if you apply the load, especially during the lower extremity exercise, the bone will respond according to the mechanotransduction principle. So bone will respond and gain in strength. So now the question is like, what is a pattern? What is a pattern? If I'm talking about exercise loading, what is a pattern? So magnitude of strain, strain rate. Magnitude of strain means what is the change in length, the ratio of change in length to the original length. Then strain rate, how much change is taking place per second. Then strain distribution. How is the strain distributing according to the shape of the bone? And frequency of repetition. Now, these are all factors which basically affect the bone modeling also, what we call the strengthening of the bone also. So this is a typical experiment which was done by Milgram et al. They actually compared the strain occurred during walking. They compared the strain as well as the strain rate, the rate of strain which occurred during walking, and they compared that with certain exercises such as a leg press, bicycle, step master, and run. So as you can see from this figure, the compressive as well as shear as well as tensile force is more in running as compared to walking. But if you compare the bicycle, the shear force of bicycle or the tensile force of bicycle, you can see now this figure actually, the first one is the walking, the second one is the leg press, the third one is the bicycle exercise, the fourth one is the step master, and this is the run. So you can see in running also tensile force is larger as compared to walking. But if you compare bicycle, there is less tensile force as compared to walking. Same way, the compressive force is less during bicycle exercise as compared to walking. compressive force is more in running, step master, as well as in leg press. And again, if you look at the shear force, the micro strain occurring at the in the walking phase is more as compared to the bicycle exercise. And as expected, there is more micro strain observed during the running phase as compared to the walking. But if you compare the strain rate, like how quickly the strain, if I'm talking about micro strain per second. So in this scenario also, you will see that running actually surpasses walking by a fair bit of distance in shear strain, the compressive force, as well as the tensile force. Here also, as compared to running, if I look at bicycle exercise produces less strain rate, less compressive strain rate, as well as less micro strain rate. So there are certain scenarios in which this information can be used naturally. Obviously, there are several studies, and it needs basically a lot of investment. So nowadays, people are doing studies on musculoskeletal modeling. They are basically doing predictive modeling. And predictive modeling using data from the 3D motion analyzer, using inverse dynamics, and as I said, 3D motion analyzer, because it automatically reflective markers are placed at anatomical landmarks. It automatically calculates your anthropometric parameters. So based on that, and coupled with certain other analysis like DEXA scan, in which you can actually find out about the bone mineral density. Ultrasound also, in which you can actually find about the insertion site also. So you can actually create a musculoskeletal modeling. People are no doubt working on that. So if you have information regarding that, so if some sort of prediction, especially if I'm talking about training perspective, how much load a player is taking based on his or her parameters. If we are able to predict that, that will actually help in planning the training in a better way. So the takeaway from this is, like, we have to take care of the forces, the rate at which the force is applied, and we have to load in all the direction. Whenever you do certain exercises, loading takes place in all the direction. So that basically helps in strength training also. So in this lecture, basically I've generalized the loading pattern of the bone, and the focus was loading pattern at the bone. That's it from my side.
Right.
Thank you very much, sir.
Yeah, Dr. Praveen, thank you for a very nice presentation. Can you hear me?
Yes, sir. Yes, sir, I can.
Yeah. Now, what actually I want was that, okay, as a biomechanist, what do you suggest to the strength and conditioning expert while they are doing some exercises? How to reduce the strain rate? What could be done? What's your suggestion?
Sir, based on these principles, the idea was to introduce various concepts, various type of compressive forces, tensile forces. So based on this, actually, we from the exercise movement only, from the muscle action only, we have to find out what kind of forces are applicable at that point of time. So, for example, weight-bearing activities, so compressive forces are there. Even compressive forces, compressive slight torsional as well as bending forces are also there. Even the same concept is used in rehabilitation. For example, if ACL tear is there and a person wants to do a rehabilitation, so there are certain things which need to be taken care of, especially in case of leg press or while doing free weight exercises, free weight extension. That means some sort of support needs to be produced, because the ACL or if ACL reconstruction happened, so there might not be a certain amount of tensile strength to bear that free weight exercises. So from that point of view, the tensile strength, suppose if a person wants to do leg extension exercises, so from that point of view, a certain supportive force which can actually provide some compression so that there is stability to thwart that excessive load on the tensile portions.
Okay.
So,
Yeah, I mean,
so
fine.
in that sense, yes, sir.
Yeah, fine. Just one thing to the physiotherapist. Let's say there is one athlete who is having compartment syndrome. The reason is that, okay, whenever he's going for, let's say in squash or tennis, whenever he's going for forehand stroke or backhand stroke, what he's doing is that lunging leg, always he's keeping it straight. Okay, there is no knee bend, knees full straight and landing on heel, then to toe, then again back to heel during the recovery phase and then coming up. So the knee is straight throughout during the lunges and then coming. Okay, once it goes, there is a lunging forward, knee straight, makes a stroke, then on the recovery phase, he returns back toe to heel and knees still straight and pushes back. So repeated activities of this has caused a compartment syndrome type of issue in this athlete. So as a physiotherapist, what are your suggestions, Ranganath? What can be done or what could be your input?
So train the muscles to take the equal load, and sometimes the change of technique also, because in shuttle badminton it is happening. We even have seen many people when they go for forward drop shot, when they go for lunge, and when they come back, if they don't use proper muscles to produce a range of motion and the strength, then there's a problem again and again. It produces repeated injuries and then it becomes an overuse injury. So strengthening the muscle with the proprioceptive exercises is what helpful, sir.
Dr. Amey, yeah, Dr. Amey, please unmute. Dr. Amey, unmute.
Sorry, I just unmuted. Am I audible?
Yeah.
Yeah. Good afternoon, everyone. So, Dr. Praveen, I just had this small clarification. Could you just elaborate more a bit on active loading and passive loading?
Active loading and
Passive loading.
passive loading. So, in terms of active loading, so from my perspective, you're talking about the contact and non-contact force in terms you want to?
Yes, like when you are gauging certain
suppose if I'm
activities in your lab.
Yeah. If I'm talking about the forward lunge as sir discussed, so if you follow a proper technique, suppose if I'm talking about heel strike, so in that particular moment, what happens is the compressive force is coming properly in the upward direction. But what is happening if you don't heel strike, if you land flat on your foot? Now, there may be non-contact injuries, like because your momentum, especially regarding your upper body, momentum regarding your upper extremity base, especially if I'm talking about the knee, it tends to take, if you lock the tibia, suppose, so, and from the femur part, so the momentum is taking care, tending, it tends to take the body in the forward direction. Now, in that instant, particularly, what happens is there is more shear force. So basically, that is because of the body's inability, especially at the striking point. Rather than striking at the heel, you are basically landing at the midfoot. So, yeah. And yes.
Kavita, what's your take on this? How people, when they do exercise like half squat, what all you suggest so that they don't get that much of stress or strain in the lower extremities?
So you're talking about squat?
Yeah, half squat. If they're doing half squat.
Okay. So basically, when we are talking about any movement which is having a multi-joint involved in it, so basically we should have a proper activation in the entire kinetic chain. So hip, knee, and ankle. Suppose when we are doing squat, so when we are moving down, there should be proper dorsiflexion along with the knee flexion and hip flexion. The synchronization should be there. So the proper motor coordination should be there. And again, for this motor coordination, there should be a proper muscle activation. So whenever you're talking about any movement, proper muscle activation, proper motor coordination should be there. Otherwise, the movement is going to be incorrect and it is going to mechanically load onto some other soft tissues or soft structures. This is my take, sir.
Okay, Nelson Matthew. Nelson is there?
Yes.
Okay, I think we have a rowing coach, Siji Kumar is there, no? Siji, just one question. Just want to know, in rowing, when the person is sitting on the boat, where he actually plants his leg, whether it is in horizontal or is it slightly inclined? Siji, or any rowing coach, or Sai Krishna, if you observed in Alapi Water Sports Center about their position in the boat.
Sir, it's not inclined, sir. It is horizontal.
Horizontal. So the
Yes,
pelvis is in line with the ankle joint or the heel,
yes.
or
Yes, sir. It is in line with the ankle joint.
it's in
and
line
heel.
with that. Okay.
Yes, sir.
So that means like if you're doing a leg press exercise, what
Yes,
should
sir.
be the position of your hip, knee, and ankle joint while doing a leg press exercise? How do you suggest? What kind of exercise do you suggest, or what is the position do you suggest to reduce
For
the
the leg press exercise or with related to rowing, sir.
leg press?
Yes, sir. So since the both of the hip, knee, and ankle also in the same line, the same thing should be like specified with the leg press also, sir, for that. But the loading should be more like progressive and rather not very high amount of loads, so that there is no more amount of knee joint involvement. It is the force and the force production should be more from the hip, knee, and ankle, and not only pertaining to knee joint.
Not pertaining to?
Just knee joint.
Yeah. Okay. Where's Nelson? Nelson, while doing leg press, let us say this is the contact point. When you are keeping your toe, do you keep it in line with the knee joint? If let's say this is the knee joint, this is the heel. So you keep the toe in line with the knee joint, or down below knee joint, or higher above the knee joint? How do you do leg press exercise to reduce stress or strain?
Sir, I think we keep it above the knee joint.
Above the knee joint. Okay.
Yes, sir.
Kavita, what is your take on this? Now this is the ankle joint.
Yeah.
Okay. Okay. This is the knee. This is the toe. Now let's say the knee is higher than the toe, or knee is in line or mid of the foot, or
Sir,
in
yes, sir. You're talking about the seated leg press or a 45-degree
seated.
seated, right?
Yeah.
So seated, it should be like, sir, it all depends upon the basic individual difference of their femur and tibial lengths. And if we are talking about stress, here, if we are talking about knee stress, it is basically patellofemoral stress, as Praveen sir has said us. So in this case, if you're talking about leg press, it depends what is the tibia length and what is the femur length. If the person has a lot of femur length, then we cannot tell that person to restrict his knee in line with the toes. So it's basically that his when he's planting his foot on the leg press board, so his ankle, his knee, and his hip should be on the straight line. But while performing the movement, as if that the person is going back, the knee may cross toe line. That would be because of the increased femur length of that athlete. So it's based. Yeah.
So I mean, is there any chance for any compression or stress or strain on to the bone in such cases? If
the femur length, sir, if the femur length is more, there might be more bending forces.
Okay.
So
bending forces on femur or
femur,
more
femur length.
And the more
the length increases, so the whole scenario of loading changes, sir.
Okay,
so scenario of loading, yeah, I'll go with Praveen sir, and yeah, the scenario of loading changes, and the more stress will be there on the knee, sir. What I feel, the ligaments will take the more load on that.
So, what can, as a strength and conditioning expert, in order to reduce that stress, what would be your suggestion? Whether to reduce the knee angle or increase the knee angle?
I think like increasing the knee angle will be better, sir. Depending on the event, as we are talking about rowing, increasing the knee angle will be better.
Okay, that's good. Okay, yeah, I mean, actually, what I'm trying to do is that, okay, we have discussed on a topic, and we are trying to have the implication part in terms of training. Okay, so that's why I'm just trying to discuss the things so that you all have an idea about how the thing is and how we could actually look into all the small factors of training. Dr. Ame, you have any suggestions?
So that's what actually he made Dr. Tilak made a very nice point. Like it will depend on the height, definitely. The more you go away from like the gravity, the joint which is bending, so the chances of injury also increase. Okay. So that's why it's like whenever there's any position, and a lot has to do also with the posture of the back. Like this is like the age-old saying, like even if there's a proper tension and everything which is going on, whether it's a torsion force, whether it's a swirling, that same way how the loading is defined, we classify fractures also in a very similar way. Whether it is due to the shearing strain or torsion or twisting or direct impact or an oblique impact. So the base of support, that is the foot, plays a role, and the posture of the back, that also plays a very crucial role in how the loading will take place and how the athlete perceives that particular load. I hope I'm making sense and I'm not confused or more.
Okay.
Yeah, I'll go with Dr. Amaya, sir. Science itself, the conditioning itself, it says wider the base, greater the stability.
Okay,
thank you, Dr. Amaya, sir.
Sai Krishna, when you get a free time, can you just take a snapshot of the boat rowing where the athlete is sitting and the just to see whether it is inclined
Yes,
or
sir.
yeah, just take a snapshot.
Sure, sir. Sir, also one more doubt I have. So, since the leg press, as Praveen sir told, and also Tilak sir told, since the leg press, like with the joint angles, the load may go on to the knees more. Is it safer to do a squat, half squat, rather than the leg press movement itself? Because the loading pattern will be, not onto the knee joint as such in a half squat, but it will be more equally distributed as a kinetic change with the hip and knee and the ankle. But with the leg press as such is like more stress or very compressive force involved in both tibia and the femur, right?
Okay, Nelson, can you give the input? What I asked?
Sir, according to me, I really didn't get the question, but he asked whether we go for the leg press or for the squats. From an athletic scenario, we always go for the squats because which is more functional and more transfer to the sport.
Full squats.
Hello.
Oh yeah. Continue.
Sir. Because you are in a free weight, you are trying to your more muscle is acting and there is a lot of muscular coordination and all this proprioceptive, everything is acting much more when you do a squat rather in a controlled environment of a leg press. So always it's good to go for a squat. That's what I believe, sir.
I mean, Sai Krishna, did you get any feedback from that?
Yes, sir. Yes, sir. I got it.
Okay, we have Rijo woman also. Rijo is conditioning expert, no?
Yes, sir.
Rijo. So Rijo is attached to which sport?
Sir, Rijo is
Cycling, sir.
attached to cycling and athletics.
Okay. So as per Dr. Praveen's study, they showed that in cycling, the strain was relatively less compared to running. Did you understand what is the mechanism behind that, Rijo?
Yes, sir. With cycling, there is no ground reaction force as such. That's one of the major reasons why there will be no strain. Mostly we are pedaling, and the quads and hams are the only forces which force to the bone. So as compared to a running scenario, cycling will naturally have a lesser strain.
Okay. All right. Darshan, your feedback? How to reduce stress in any of the lower extremity plyometric exercise? Suppose someone is doing plyometric. How to?
Yes, sir. So the first question that you asked about squats, as we all know that there is a lot of compressive forces on the joint if the technique of squatting is not right. So we don't want any direct loading on the joint, which generally happens with improper technique. So as Kavita rightly pointed out, the right for muscle activation is required. And about the whether the rowing would be beneficial with leg press or the half squat, I feel as Nelson rightly answered, we need to go with more compound exercise and more functional exercise, that is a squat, rather going for leg extensions, because it is more of a open chain exercise, and squat is more of a closed chain exercise, which is more beneficial.
Okay, Praveen, see, there are people who are actually running in athletics with aerial, they call it as aerial runners and terrestrial runners. That means the people who are having heel kick more and those who actually don't have any type of heel kick, they just lift the leg slightly in the air. And so in terms of these two athletes, who will be having this kind of stresses more? Basically. Yeah, unmuted.
Yes, sir.
Yeah.
Sir, so it basically caters to like, sir, which portion strikes first? Sir? So if a person is not able to do proper hip flexion, optimal hip flexion as well as knee flexion, so chances are there like heel strike will be there, sir. Heel strike will be there. So we have to avoid the situation in which that heel strike is there,
Okay, someone
especially
is
middle distance runner.
okay.
So naturally, sir, if we have to avoid that, like just before striking, the dorsiflexors actually here dorsiflexion actually plays a very important role in this regard, sir.
Okay, someone is doing conditioning. Okay, so there are athletes who are running down the hill, uphill. Okay, so Harmanveer is a conditioning expert, no? Harmanveer, hello, Harmanveer.
Yes, sir.
So someone is running downhill and someone is running uphill.
Yes, sir.
So according to you, who has more contact time on the ground? Which athlete will have more contact time on the ground, and which athlete can have more strain or stress onto the joints?
Sir, the contact time would be more when you're running uphill because you land the foot and you're trying to push off against gravity, and you'll have lesser contact times when you're coming down the hill. But since coming down the hill, you'll be absorbing more forces because you're trying to control your body weight going down the hill. So I think the more impact would be when we're going down the hill. But we'll have more contact time as we go up the hill.
Okay. Some of the athletes are doing lunges with barbell. So, what would be your advice as a strength and conditioning expert in terms of mechanics, body mechanics?
In terms of body mechanics, so usually we want their legs to make a 90-degree angle, both legs. Both knee angles should be 90 degrees, and we want their the upper torso to be straight. And that emphasizes more quad activation. But if we lengthen the lunge a little bit, that can lead to more glutes and hamstring activation. So it really depends on what muscle we're trying to target for the lunges, because we can do variations, and those variations can make subtle changes and they can activate different muscles. So for sprinters, usually if it's an athlete, sprinters or jumpers, I'd usually want to emphasize on the quads, and I'd want them to have the 90-degree angles on both knees and make the lunge a bit shorter than the usual so that they emphasize more on the quads.
Okay. All right. Vijesh, according to you, when you're training the athletes, what all difficulty do you find in terms of athletes complaining about knee joint? That is a bone, there is a shin bone pain, or any pain in the joint, and so on. Vijesh. Vijesh is not there. Okay, let's call on Gautam. Gautam.
Sir.
Sir, good evening, sir.
Yeah, good evening.
Sir, may I?
Yeah.
Sir, basically, if we look into the overall quantification of Taekwondo, the pie chart, the bigger area will be taken by the technique. So as far as the knee, ankle, and hip joint pain or the problems in training, what I commonly see is it is technical problems where, say, if it is a strength and conditioning session and they are, say, for example, they are doing a squat jump. So the problems are seen in the triple extension, the takeoff, the landing part, the synchronization of the movements. And then because a lot of kicking is involved, so I find most of the athletes are complaining if there is a kick is missed the target. So there is an extension there. We find that the loading in the joints. And one more thing, sir, that is the overuse, lot of stepping. So Taekwondo athletes have got a lot of shin pain. Then when there is the mechanical, they are not using a proper shock absorption of the heel to the mat. and sometimes with the wrong footwear. So those things will also sometimes, help us to like if they are not able to do proper kicking. So when I ask what happened, you're not doing proper bouncing, which is very important. Then they say, sir, there is a shin pain in. So that stepping time, they'll put heel, not a proper shock absorption. These are the common things we normally find, sir, in the training.
How about volleyball? Jewel, can you give some feedback?
Yes, sir. Sir, I'm just facing, we are jumping a lot of jumps we are performing while training, and most of the children's, their training age is, those who are having more training age, they have, they are getting knee pain. They are complaining that they have pain. So the one thing what I felt is their landing technique is wrong. They are habituated with the wrong landing technique. So I tried to change them, but it's not working because, they were doing, I think, more than 4 years. A few kids, they were doing 3 years, and it's not working with them. They're not understanding what I need from them. And another thing what I felt is, they were talking about this squat and everything. Those who are having the training age, they learned a wrong technique. When they got knee pain, they started to do the squat with the pain. So they're adjusting their, when I am standing behind them, I can see their glute is turning one side. They are not performing the exact squat position. So what can I do for this, sir? If it is, the beginners are doing well, but those who trained earlier, they got knee injury, knee pains. They started doing a wrong technique instead of going for physio or anything.
Okay, Praveen, Dr. Praveen. So under this, what's your suggestion for technique correction? What can be done?
Pardon, sir?
For these people, volleyball players,
Yes,
and also taekwondo, they have mentioned some of the issues. So what's your suggestion for them? You are mute.
Sir, hello.
Yep. Gautam ji. Yes.
You didn't hear their conversation?
Sir, some message came, sir.
Okay.
Sir, I was.
Sir,
Nelson. Yeah.
Sir, I've seen this, as Jewel sir said, the volleyball issue. So many of the athletes have this. I've seen with the badminton also, there is imbalances when they do squat and people trying to compensate. So I think they should go for a unilateral training for some time, and then they can correct that and they can go. And definitely there is a strength issue, as I said, this repeated knee injuries. And when they are doing squat, they have an imbalance because they are shifting. That's what sir said. I think that's what I think he meant. The glute is shifting to one side. That is completely a dominated leg. They might be shifting the weight. So they all should go for a unilateral training, maybe a 4 weeks or 5 weeks, and then they shift to double leg training. I mean, the double leg training, then it should be better, and they all will be recover, I feel so.
Okay.
Sir, we're talking about squat, sir. What I understood from the conversation.
Yeah.
Sir, and regarding the knee issues regarding the squat, sir. So, yeah. So during our assessment also, like what we did with strength and conditioning experts also, I think Kavita was there. So during functional movement assessment also, as well as during asymmetry test also. So we found certain players who had valgus knee. Now, sir, valgus knee, if you talk, sir, coupled with functional movement assessment, it may be due to gluteus medius or VMO also, sir. And sir, there are other reasons also, like it may be extreme. I am talking about like So there are several reasons. So with the functional movements screening and with the help of physiotherapists, MSK testing, so we can find out actually what is the actual scenario, and then we can go about that, sir.
Yeah.
Most of the time, because gluteus medius actually is opposing that. So if the gluteus medius muscle is weak, so that knee tends to go inwards, sir.
Okay. Our Ranganathan, any any suggestion from your side to reduce this kind of issue, pain?
Sir, may I just jump in? I think Darshan want to share his point in strength and conditioning. Sir, regarding the issue which the volleyball coach just mentioned, okay, so I think first thing that we need to do is decrease the load that the athlete is doing as of now, and see if all the joint mobility is intact and the muscle flexibility is intact. So first we need to start with the joint mobility, flexibility, and then start with technique correction. And then once we feel that, okay, the technique is right, that's when we start loading. Even though he's an elite, even though he has a training age of about 4 to 5 years, if he is not doing it properly, and that's when he's getting all the knee pain or back pain, we need to follow this procedure.
Mandal sir, do you have any suggestion? Okay, what should be the strength level for basic strength level for people who have?
No, sir, I don't have any suggestion, but I have one question for myself. I am suffering from medial meniscus injury, which happened while playing football. Now, I just want to know either from Praveen or from the strength and conditioning expert, while playing, still now I am playing football, I am taking the risk. But what kind of movement I should restrict? Because medial meniscus injury, it is a common for most of the footballer. It is common.
Sir, so as we know that in football, when there is multiple direction involved, we can't really restrict any movement as such, because particularly, and medial meniscus tear, it generally happens. Any injury for medial meniscus, it is associated with the rotational forces at the knee. So what best we can do is, without stopping the sport, we probably have to strengthen the structures around it and reduce the pain, and we need to continue playing. There is no particular movement pattern which you can stop while playing football, because it is a multi-skill oriented game.
Any kind of exercise you will suggest?
To that, from physio side,
any kind of exercise you will suggest?
Yes. What we can do, addition.
You can go for leg extension. Please, Rana, sir, you finish off.
Yes. So in physio side, yes, we need.
Sir, here I want to discuss something, sir.
Yeah.
Issues. So it's particularly regarding the biomechanics of knee brace. So how do you think it is? What do you think? Like, is it beneficial, or it may prevent that, or like it may alter the healing process also, if some kind of injury is there? So, sir, that I want to discuss this knee brace.
Yes, sir. Knee brace, the post surgery. If I have to talk about the knee brace, it's in post surgery. So initially, when we have to get the movement stability and everything to avoid any excessive forces or excessive movement, we have a lot of brands which is coming. Donjoy is the brand which is many orthopedicians prescribed, because it gives a good solidity on the knee joint, so that any excessive movements can be avoided. So this is regarding post surgical issues. But in normal, when we see the people who are 45 and above who wear the knee cap, I don't find a major support with it.
It actually reduces the
sometimes
capability. No?
It just holds the muscle. So instead of muscle holding the joint, the external structure which compresses and holds it. So the receptors also thinking, okay, it is supported now, and that is how we feel also comfortable with it, sir.
Yeah.
And recently, yes, we have this open patellar knee braces are doing better than the full sleeve braces.
Because one doctor told me that it has to be operated, otherwise I cannot. It happened in 2017. So that time one doctor, I don't want to name, he told me you have to go for surgery, otherwise in life you cannot play football. But I took a challenge. I told him without doing the surgery, I will play and I will show you. And I started playing, and that is already, I've been thankful to two physiotherapists, one from SAI, our Bangalore, and another from Hyderabad in rowing camp. So they gave some exercises. So I will discuss with you that what exercises they are given. So that seriously, I have done that exercises, and that I have started football. But only thing what I feel, while forward kicking and backward heel, giving that back heel pass and no problem. While that lateral movement only, I am feeling pain. That is the thing only. In the lateral movement when it is there. That's why I was asking that any movement to be restricted or not.
We have a very good physio setup, sir. We just need to meet once and then we'll analyze and do the assessment and see what are the structures involved, which are the structures giving pain, which are the movement giving pain. So we can work on those muscles and then we can work on the rehabilitation if needed, and we can continue with our strength and conditioning.
Yeah,
So
and
that
for
is
the
how we can do that.
football, for the footballers and football coaches, it is very, very required actually.
Yes.
Because most of the footballers I have seen in my life that some or other, one or other meniscus injury was there, and after that some operation, everybody. It has from Bai Chung, Vijay, and everybody has gone through that one.
Okay. All right. It was very much interesting to hear a lot of discussion and a lot of exchanges. I feel this is the way actually we need to learn and discuss the things so that indirectly we can reflect all this into the athlete's performance. And yeah, I think I have another meeting at 4:30. Thank you all very much for the participation, and thank you, Praveen, Dr. Praveen, for putting up this talk on bone loading. And see you all tomorrow. Bhaskar, what's the time tomorrow?
3.
Same timing, sir. 3 to 4.
3 o'clock.
Okay. All right. Then see you all tomorrow.
Thank you, sir.
Good day.
Thank you, sir.
Thank you, sir.
Thank you so much.
Thank you.
Thank you,
sir.
sir.
Thank you,
Thank
sir.
you, Saju sir. Thank you, Praveen. Thank you, Darshan. Thank you,
Thank you,
Ranganathan sir.
Thank you, sir.
Thank you, sir.
Okay.